In our Society of International Society of Hair Restoration Surgeons, a study was conducted amongst all members. A questionnaire was sent, and they were asked whether what type of anesthesia they are using and what their patients are like. Are they happy with the surgery as per the pain condition? Most of the members replied, like they said, they had their own protocols. Everybody had his own protocol regarding anesthesia. There was no set protocol for each and every doctor. Every doctor had its own protocol, so it varies from doctor to doctor. As we know, hair transplant has drastically improved in the last 10 years. Anesthesia for hair transplant has not shown much improvement and can still be painful for many patients. What are the characteristics of ideal anesthesia? It must emphasize safety. Procedure must be painless. Ideal. Anesthesia should be long-lasting. There should be minimal blood loss. The patient should be wide awake and should be discharged as soon as the surgery finishes. Post-operative forehead swelling should be minimal. At our center, we did a small study in our patients, and our patients were asked to rate the procedure on a scale of 0 to 10. Without additional measures, most of the patients said their pain was at 5 on a rate from 0 to 10, where 8 represents toothache pain, severe toothache pain. With additional measures, I'll come to those measures, the pain reduced to 3. And with Entonox, there was no pain at all. Local anesthesia for hair transplant should have rapid onset and should provide long-term anesthesia. The local anesthesia varies from physician to physician. The most common anesthetic agents used, lidocaine, it acts very fast, and the same dose is 4 mg per kg body weight, a total of 30 cc without epinephrine can be used. But with epinephrine, we can go up to 7 mg per kg, 50 cc total solution. Vibratory, also used for hair transplant, has a maximum dosage of 3 mg per kg, and it counts to 20 cc, and you should not exceed the same dosage. What is the role of epinephrine? It increases the efficacy, prolongs the action, decreases the absorption of anesthesia, decreases the bleeding, and in female patients we use 1:2 lakh to 1:4 lakh concentration. There are basically two types of techniques which are employed in LA. They are nerve blocks and field blocks. In the nerve blocks we use protrochleus, proorbital and greater occipital blocks. In the field block we use continuous field technique. In FUE, the greatest cause of pain is the injection of local anesthesia. We can provide a relatively pain-free procedure. How can we do it and reduce the pain? First and foremost, sedation. What is the role of sedation? Sedation increases the patient comfort, it decreases the anxiety, decreases sympathetic stimulation, decreases pain from the local anesthetic injections, decreased vasovagal episodes, and elevates the anxiety of lengthy procedures. We commonly use 0.5 mg clonazepam for oral half hour prior to the procedure. It decreases the toxicity associated with increased dose of lidocaine, and it calms the patient. Other sedatives that are used are 5 to 10 mg diazepam or midazolam 1 to 3 mg IV. So there are certain techniques that are employed during the injection of local anesthesia, which can significantly reduce the pain. First and foremost is vibration, and then buffering, warming, needle size, rate of administration, topical anesthesia, and OT aura. What the vibration is going to do, the vibration and movement significantly reduce the level of discomfort during anesthesia injections. It works by the gate pathway. When in the closed gate pathway, the large diameter sensitive fibers, they transmit the signal, and the smaller diameter sensitive fibers which carry the pain, they are blocked, and the gate gets closed. In the open gate system, where you don't apply the vibrator or a mini massager, the large diameter fibers don't work, and small diameter sensitive fibers carry the pain. Next step is buffering. The pH of the lidocaine is between 4 to 6. Adding epinephrine pH decreases more pain. So the mixture which is available readily, the xylocaine with epinephrine should not be used, as it has low pH and causes a lot of pain. So we should always mix xylocaine with epinephrine at in our routines. So the buffering can be done with 10% of 8.54% bicarb with lidocaine, but it has got a disadvantage: increased bleeding and increased post-op edema. Warming of the LA to body temperature significantly reduces the pain. Especially in Kashmir, it's very cold, so we have to just warm the bottles before injecting. Another important factor is needle size. Smaller the needle size, lesser is the pain during the injection. A 31 gauge needle, which we normally use, produces the least amount of pain. We have to inject slowly. This is one of the most